Health researchers have said that cervical cancer is the second most common cancer among young girls and women in our society, and 12,000 women in Nigeria are diagnosed with the disease, and 8,000 die from it yearly. To put a stop to this end, global health experts in collaboration with the Nigerian Institute of Medical Research have gathered young medical experts to train and help come up with ideas that will be acceptable for women and girls to be vaccinated and encourage women to go for screening that will support and bring solution to the disease among women and girls in the society. Speaking to journalists at the Young Expert Ideas Solution, the Director of Research at the Nigerian Institute of Medical Research, Professor Oliver Ezechi, aired his view on the causes of cervical cancer alongside Professor Juliet Ezepu, Principal Investigator for Girls and Women from St. Louis University, on why the need on young people ideas.
Find the cause of cervical cancer, and that's human papillomavirus. That's what causes virtually all cervical cancer. Once you vaccinate the young girls who are between 9 to 15 before they're exposed to that virus, you prevent them from having the virus. And for those ones who are already above, women who are already above that age, you screen them for cervical cancer. What it means is that we'll join other committee of nations to eliminate cervical cancer by 2030.
The goal is to make sure that there are no NGs anymore in Nigeria. We want to ensure that we work with Nigerian girls, with Nigerian women to end cervical cancer together. We can only do it with you leading the way, not the experts telling people what to do. Because there are many people doing screening, there are many people doing vaccination, but yet only 10% of girls have been, only 10% of women have been screened. Only 14% of girls have been vaccinated. Our goal is to change that, and we have to change that with Nigerian girls and Nigerian women leading the way.
The low use of cervical cancer prevention services among girls and women in Nigeria can be traced to several reasons. Dr. Okechukwu Unwachukwu from the Federal Ministry of Health in Nigeria aired his view on the reason alongside young experts on how they intend to drive the message to the society.
In taking steps to ensure that it is eliminated in Nigeria, starting from what we call primary prevention, secondary prevention, and tertiary prevention.
We are going to meet with the community leaders, and then with the help of the community leaders, we'll be able to gather these women. You know, we are sure, and we all know how these unions work in the marketplace. There's usually a union of market women, they have their leaders. Once you're able to talk with their leaders, and the leaders agree with whatever you have to say, they are able to talk with their people, and then by the time we're able to bring those people together, we have been taught, we have been enlightened, we have been sensitized about this cervical cancer, and we are simply going to replicate the same learning, the same thing that we've been taught to these women. We're just going to educate them as we have been taught.
However, researchers have stated that human papilloma virus vaccines have been found to reduce the risk of cervical cancer up to 90%.